was the genesis of multidisciplinary or multimodal pain management center. And part of that is forgive me, I haven't described, I've been in surgery all day, but part of that includes movement therapies, okay? And that's why you all are here. And so many times I see patients that are so debilitated, so deconditioned, that just the smallest amount of movement would just set them up for failure. And they just avoid it, and then they just have this fear avoidant behavior and movement avoidant behavior. And so it is my pleasure to have been worked with Amy and Analii to help these patients overcome their fear of movement and this avoidant behavior, because the body's designed to move. It wants to move, and as you'll hear from some patients, and as you'll get to talk and know each other, you get to realize the benefits of how this graduated movement, graduated exercise improves function, and that's really the goal. There's two types of pain. There's acute pain and there's chronic pain. Acute pain has a function. It has a purpose. It tells the body that there's actual damage going on. Avoid what you're doing. But it's finite. It's defined, and there's an endpoint to it. Chronic pain has no use. And chronic pain is present beyond the time period in which the tissue damage occurs. And so the movement helps to actually break through that barrier. And what I try and focus on as a chronic pain management physician is not necessarily focusing on, hey, what is your pain? Is it a 1 through 10 today? It's how functional are you? And how much improvement in your function are you gaining? Okay? And along with that will come better pain management. And so, please, I'm so happy that you guys are here. It's a great crowd, a great turnout. And what we're doing today was really the genesis of Analii, is part of community education. And community education to say, look, there's an alternative. And as a physician, when I see patients in the office, I say, okay, go to physical therapy, but I recognize that there's just so many patients I see are so deconditioned that it would just be a setup for failure. And so there is an alternative, and a lot of you today are going to get a chance to either participate, explore, or observe those alternative movements and therapies. Okay. So thank you so much for being here. I really appreciate you taking your time out to be on a Friday afternoon. Welcome, and I really hope you get something out of this today. Okay. Is Dr. Copeland going to speak?
He's next.
Yeah, okay, great. So it is, I'm a better physician for having known Dr. Copeland. He's a well-accomplished orthopedic surgeon here in Grand Junction. If any of you have been here for longer than about 5 minutes, you would know, or have been operated on by him. Okay. And he's actually going to speak as a patient. So Larry, thank you for being here today. I appreciate it. Welcome. And if these people get half as much out of how much I've gotten to know you over the last 6-7 years, it'll be a great benefit. So thank you. Yeah.
Thank you.
Yeah, you're welcome.
It's nice to be here. They wanted somebody young to be here, so they I'm actually going to Analii's class on Tuesday and Thursday and really enjoy it. I've been retired now, going on 3 years, and had a great career. I did orthopedic surgery for 45 years, family practice before that, and so let's see. That may be a little bit older, but I started when I was 10. Yeah. I'm a DO, or an osteopathic physician, and our background is a little bit more in the holistic and preventative philosophy, and that's helped me as I've practiced. I did my residency in Detroit, Michigan, and did a lot of sports medicine. I was a team doc at Mesa for 30-some years. And in Detroit, we took care of the Tigers, Red Wings, and the hockey team, Red Wings. So I've always enjoyed that. And of course, activity and motion and exercise is a very big part of what I've tried to do. I enjoyed the surgery end, but it was, I think, later on, seeing just mostly problem patients, getting the patients to change and affect their lifestyle was as important to me as anything. basic to my feelings. And her thing is kind of micromotion and balancing and stabilization and normalization. And it's what we call homeostasis, or the normalization of body function. And that's very important. Let me just a couple of notes. I felt that it was important for me to diagnose the patient properly and then treat them effectively, and in my case, surgery sometimes. But I'd see probably 30 patients for every one that I operated on. If I could get them to change and modify their lifestyle, that was first, and that was more important. So healthy diet and exercise is a big factor in that. I've said, coined a phrase of the exercise deficiency disorder. Exercise deficiency disorder. And it causes so many problems. When we don't exercise, we build up lactic acid, decondition, and it leads to this exercise deficiency disorder and a lot of problems. A lot of type 2 diabetes can be treated effectively with lifestyle and exercise changes. And that was really a lot of our goal. And what Analii teaches is so beneficial and such a great factor in a healthy lifestyle. Had a couple of sayings over the years: which is better, to exercise an hour a day or be dead 24 hours a day? Exercise is medicine. If you rest, you rust and escape the sofa. So, and a lot of what she expounds is the core strengthening and the balance. The body is greatly affected by gravity, and just like water goes down a drain one way, our body tends to decompensate in this rotational downward motion. And if we don't exercise and maintain that motion, we'll get restrictions. And it first starts generally in the sacroiliac joint in the pelvis. And I've said for years, if the car and clerical work had not been invented or done, there'd be 70 to 80% fewer back problems. If we walked and didn't sit, we'd be so much better off. But it's not the way it is. When we don't exercise, we get restricted, the lactic acid builds up, causes that achy, yucky, sore, stoved up feeling. And then that leads to other problems. And so it's really important. You have to have good circulation for normalization and body function. So you have to exercise, get it pumped in, flush out the waste products, and you feel better. You feel better and everything. Of course, lifestyle is most important. I think the biggest societal screw-up of the 20th century was smoking. It created so many problems. It affects healing tremendously. It's now the #1 cause of failed spine fusion in the world. And so I preached a lot against smoking. And anyway, what she does with movement and core stabilization is really great. And she's kind of rough on us. Stevie said Anyway, good. Well, thank you.
Thank you. Yes.
Dr. Langston, Dr. Copeland, thank you very much. What we are going to do from here is I'm going to have Analii talk real quick, and then we're going to move from our chairs. Feel free, you can bring all your stuff. We have cubbies and everything down in the flow room. You can put your coats, your purses, or whatever down there. We'll break you into some groups and we'll kind of talk and move at the same time. So I'm going to let Analii talk real quick, and then we'll head down the hall.
Yeah, and we won't talk long, and Amy is going to introduce herself and talk in a minute too. So thanks. It was a good intro to this work, and so you've heard what both have said about movement, and yet many of us have moved big, and we've been athletic, or we haven't moved at all, and all of a sudden things aren't working. So this micro-movement work is really accessing smaller movement, almost movement that you can't perceive, because when we move small, we're engaging our intrinsic, or the short movement creates big movement. Most of the joint problems, most of the things are because, so I'm shorter, so I really have an advantage because I didn't have longer legs and limbs yanking at my joints, but still, and yet at 53 I do encounter things. So micro movement, you can sit in a chair and do it, you can be on the floor and do it, and when you feel the movement, you're going to feel like you're barely moving. You're moving from almost, I call it the baby crawl movement. We go back to that basic, and then we rebuild. We're rebuilding a different pattern. And then it comes into now these movements, how do I function? What am I doing when I'm bending over and mowing the lawn or pulling a weed? Did I just restrict? Did I take restriction with me, or did I let it go and let what I call the wheel happen? So it's balance. Everything moves in a circle. Most of the time we're moving in an angle. So that's what you're going to get a little taste of, and don't be afraid. It's just, I've got a lot of helpers. I've got several of my teachers here, and we're going to all kind of plunk through it together. I call it a workshop format. And then Amy is this expert, awesome, and she's my go-to person when I have any real questions anatomically, and so she's going to talk about the functional part, and then we'll move in there.
All right, thank you. So I'm sort of tagging along today. I met Analii 6 or 7 years ago when I moved back to Grand Junction after being gone for 20 years. I'm a physical therapist, and I specialize in pelvic health and women's health, but I did orthopedics for 15 years prior to that. So when I met Analii, what I say about Analii is she's taught me so much as a physical therapist. She takes you and fine-tunes you and gets that movement started, sort of working from the inside, and then we go to the outside of function. Things like, how am I even standing right now? How do we take what Analii teaches you and teach you how to brush your teeth so your back doesn't hurt? Or how do we stand when we do dishes? How do we stand elongated? So I take it more functionally. How do you get out of a chair? Using Analii's techniques, and then techniques that I throw in also to help so your knees don't hurt, your back doesn't hurt. And we really take it and tweak it for each person. So she does the fine motor stuff and fine tunes you, and then I say that I do the big gross motor type of things. And we are constantly talking and coming up with new ideas for